The Stanford Biodesign Innovation Fellows spend their time with us learning and applying the biodesign innovation process to real-world healthcare problems. The fellowship is broken up into 6 parts. The first part is Bootcamp, and that takes place over the first month of the fellowship.
Bootcamp was a really fun and also very exhilarating experience. It's a chance to see the whole biodesign process in rapid-fire succession through all of the stages.
The fellows do this by completing a mini project. They take an unmet clinical need through an accelerated version of the biodesign innovation process.
So you need a way to restore alignment of the eyes in children less than 7 years old in order to reduce the number of strabismus surgeries performed.
In parallel, they go deep into their specialty area for the year, learning from physicians and other healthcare providers all about the ins and outs and workings of that specialty. They also get a crash course in critical business and engineering topics that will help them develop a viable healthcare technology. Last, they spend time on team formation and building the foundation that they'll use to have effective teamwork together over the course of the fellowship.
I think the team members all find that learning how to communicate, learning how to give feedback, receive feedback, how to work with other people in a way that's respectful and animating is really one of the most valuable parts of their experience.
Next is needs finding, where we send the fellows into the field to observe and identify unmet clinical needs for themselves.
The clinical immersion falls right after boot camp, and it's the first opportunity to do direct observation of clinical care in the outpatient, inpatient, and post-care environment.
You can go into clinics, you can see surgical procedures, you can observe patients. For me, this was a real highlight to the program.
Once they've identified a critical mass of needs, the fellows move into needs screening, in which they use intensive and progressively more detailed research to determine which needs represent the most compelling opportunities.
Needs screening is a process where you take all of the 200, 250 needs that you've identified and start to filter them into buckets to understand which ones can be viable.
It's an objective process. It's a process where we take the merits of each need and have it compete against others so that the best opportunities based on market size, disease state, existing technologies, and stakeholders will emerge as the best projects to work on.
Once they narrow in on a handful of top needs, the fellows move into concept generation. This is where they brainstorm multiple different solutions to each of those top needs.
Concept generation is probably one of the most exciting aspects of the Biodesign Fellowship.
We're going to kill the bacteria. That's our approach. Even for killing bacteria, you'll have like 6 different concepts.
Yeah, exactly.
By the time we got there, we were so ready to start brainstorming and putting our ideas out there. So my team just let loose once we got a chance to get to that point and build concepts off of the need statements that we generated.
After that comes concept screening.
Concept screening really involves understanding your concepts more deeply and pulling in these other factors such as intellectual property, regulatory affairs, reimbursement that help you to start to unpack these layers of whether or not a particular concept might be successful.
This is also when the fellows dive into more advanced prototyping and engineering in order to determine the technical feasibility of their solutions.
And the esophagus is about this big when it joins the stomach, right?
Yeah.
That's what you're saying.
It's really the same objective process we often use in need screening, but we apply it to our concepts, where concepts compete against each other for the best project to move forward.
Finally, the fellows move into implementation, which involves both strategy development and business planning.
We could charge $15 million if we can say that we're saving you 45.
But that would be if you have 100% market penetrance.
That's with 100% market penetrance.
Implementation is really around building a realistic project plan that could get that technology to the patients.
This part of the training experience and the biodesign process is complex because it involves so many different risks to consider and factors to integrate in order to come up with a cohesive plan. But this is really also where the vast network of mentors becomes so valuable to the fellows.
We were able to get really in-depth expertise from many different types of mentors from within Biodesign and also from outside to understand the key aspects that would be critical to whether or not our desired solution at that point could be made into a viable project.
And finally, we really do career development, including a specific time where they go on an externship to a company or experience that can really bolster their career. That's the year in a nutshell.